Before I move on to our next commencement, I'd just like to welcome our guests in the Distinguished Visitors Gallery from the Irish Wheelchair Association. You're very welcome to Leinster House today. I understand that you're guests of Minister Senator Hackett, and I hope you have a very enjoyable day and an informative day here in the House. So our next commencement is Senator O'Loughlin.
Thanks very much, Chair, and thank you, Minister, for being here to give a response to this important commencement matter. Last week, Minister, in this chamber, I raised issues and concerns which had been raised in relation to HSE-funded post-mastectomy products, and I'm really glad that Minister Donnelly showed real leadership and intervened, as he recognised that the threshold of support provided under those new procedures may lead to a number of women receiving less support than previously, and he asked the HSE to amend the procedures to ensure that no woman either currently availing of the scheme or possibly accessing it in the future would be at a financial loss as a result of the changes. And of course that was very welcome, and to see him using his influence to further support women's health care in our country. Now, in a slightly similar situation, I've been contacted by some local hair, scalp and wig specialists from my own area in South Kildare, and the First Lady that contacted me reached out to express her concern in terms of changes in the terms of the provision of scalp and wig therapy funding through the HSE, and she was concerned that proposed changes to the funding stream for hair therapy pieces would negatively affect those suffering from alopecia. Now, when I looked at this a little bit further, no more than the post-mastectomy supports, there seemed to be a postcode lottery in terms of what women would receive. For example, in Kildare, they would receive €750 worth of scalp therapy, wigs, etc. In Cork, 450. In Kilkenny, 550. Now, obviously it's important that we have a standardisation of the amount right across the country. It shouldn't be a postcode lottery, no more than with the post-mastectomy pieces. And also I should add that there should be, this should be limited to those who have specific training in that, because hair loss isn't part of hairdresser training, unfortunately. So I think it's important that there would be specialist training that would be recognised in relation to this. From my conversations with Aileen, I am informed that a HSE funding stream was available for the provision and funding of hair, scalp and wig therapy for those suffering from alopecia, as well as those suffering from hair loss because of cancer. But that proposed changes that were due to come into effect on or after the 4th of March 2024 will remove this entitlement. Now, I did seek clarity from the HSE, and they came back to me and said the introduction of a national standard with an increase in the allowance for the majority of areas in the country, along with the ending of the inequities that previously existed, is welcomed by service user support groups, the Irish Cancer Society and healthcare professionals working in the area. Eligibility is expanded, procedures are simplified and service users provided with great choice. And that's really excellent, Minister. No issue with that, and I think we would all welcome it. But it does not clarify for me or for any of us the situation in terms of those with alopecia, which is why I'm raising this in the chamber today. Losing one's hair, whether it is as a result of cancer treatment or due to conditions such as alopecia, is very, very traumatic, and it can have hugely negative impact on people's self-confidence and esteem, and especially for women. Our hair is inextricably linked to our sense of self and our identity, and many women would choose not to leave their home than go out without an adequate wig or hairpiece if they're suffering hair loss. Alopecia is a medical condition, and it's often the result of an autoimmune condition, and I really would appreciate some clarity from you, Minister.
Thank you very much, Senator. Minister.
Thank you, Senator O'Loughlin, and on behalf of the Minister for Health, I'd like to thank you for raising the matter. I hope I can provide some clarity, though I'm not sure if I can provide all, but I will try to come back to you with anything that I cannot. The Senator is aware that the HSE provides an extensive range of aids and appliances to people living with different medical conditions to try to help them enjoy a greater quality of life than may otherwise be the case, and many of those products are provided under the community funded schemes. So at the outset, it's important that I say that the new proposed procedure in respect of hair loss was for cancer provision only and had no impact on non-cancer related alopecia patients. As part of the HSE's improvement programme for the community funded schemes, a HSE National Advisory Group had examined the provision of an allowance for cancer treatment related hair loss. The HSE had recently published a new national procedure for the provision of an allowance for cancer treatment related hair loss. The HSE advised that the aim of that new procedure is to improve access and ensure patients with cancer treatment related hair loss who would like wigs, hair pieces, hair loss solutions, that they receive a standardised allowance no matter where they live, precisely as the Senator has said. The HSE have advised that awareness of a significant variation in the practice of funding hair loss allowances across the HSE means that a standardised approach should be implemented. I think, as you have already said, you agree with. The level of the allowance provided for in the new proposed standard operating procedure was set at €600. The procedure and the allowance level allocated were to be subject to periodic review. Upon learning of the proposed changes, the Minister instructed the HSE to ensure that no patient, either currently availing of the scheme or accessing it in the future, would be at any financial loss as a result of the proposed changes. The HSE has since communicated to each CHO advising them to revert to the pre-existing level of contributions to patients in respect of hair loss until such time as the new procedures can be reviewed in terms of the proposed allowances to be provided in the interim until it's all dealt with and sorted. CHOs were also instructed to contact any member of the public who had received an email or a communication advising them of the new procedure to inform them that it has been withdrawn. This communication also reiterated that no person should be disadvantaged in any way in the intervening period, and the Minister welcomes this clarification to all CHOs. He also wants to ensure that the necessary supports are put in place so that every person has the same level of access to appropriate healthcare no matter where they live in Ireland. I'm not sure it addresses the alopecia question precisely, but I do think it's important that you raise it, perhaps to provide some clarity in respect of confusion on the cancer-related piece.
Thank you very much, Minister. Senator.
Thank you very much, Minister. And just the third paragraph that you mentioned, it's important to note that the new proposed procedure in respect of hair loss was for cancer provision only and had no impact on non-cancer related alopecia patients. I take from that those suffering from alopecia will still be entitled to the same allowance as before. So I think that is bringing clarity, and I thank you for that. And then in terms of the standardised allowance, we both agree that's absolutely where we want to be. And I appreciate that the Minister has instructed the HSE to press pause until there is further clarity in relation to it. But I honestly feel that in terms of that paragraph that I've just reiterated, that it's clear that there may be proposed changes for cancer payment in terms of standardisation, but that there will be no change in terms of those suffering from alopecia. So that's exactly what I want to hear, so thank you for that.
Thank you, Senator. Minister.
Well, Senator, that is also my reading of it, but I'm at like 96% and I do like to be at 102. So that's my gap, but that is also my read of that also. Would like the opportunity to go back and just clarify it for the Senator so that we can get to 102%. Yeah.
Appreciate that. Thank you.
Thank you very much, Senator O'Loughlin. And Minister, thank you very much for your time here in Seanad today. We appreciate you're very busy, but it's very much appreciated that you're here. So thank you.